Okay, so welcome to all of you, and today we are going to discuss regarding the posology. Okay, so it is the title of this lecture, posology, and the credit of slide presentation is goes to the Mr. Ravish Kumar R. Patil. He's from Dr. Sivaji Rao Kadam College of Pharmacy, Kasabe, Digras, Sangli. Okay, so I'm giving the credit, full credit goes to the Mr. Ravi Kumar R. Patil, okay, because I am taking from slide from this guy. Okay, so thanks for this guy. Okay, so first I come on the first slide. In this slide I have mentions the introduction. Okay, so in introduction you should learn what is the posology. Okay, so posology, first of all, one point, it is very important point. Posology, if it is derived from the Greek word posos. Okay, so posos means how much. Okay, so how much it indicates the quantity. Okay, if you see the how much, then it is regarding the quantity. Okay, and logos means signs. Okay, so study of how much. Okay, and logos means, you all of you know that it is the meaning of science. Okay, so posology is the branch of medicinal science which deals with dose. Okay, it is regarding the dose. Okay, or quantity of drugs, how much you can any pass you are giving to any patient, in which amount of or quantity of drugs. Okay, for a particular pharmacological activity. Okay, so it is the means science which deals with the dose or quantity of drugs. Okay, which can be administered to a patient. Okay, patient to get the desired pharmacological actions. Okay, so you can see further that it is the branch of medicinal science dealing with the dose or quantity of drug which can be administered. Okay, so administration may be different types. All of you know that doses form of drugs, it may be oral, or it may be parental, or it may be infusion, like that. Okay, so there are lots of doses forms are used in pharmaceutical, in medicinal science, you can say. Okay, so it is administered to a patient to get the desired pharmacological actions. Okay, so हम यहाँ पे एक pharmacological response पाने के लिए how much quantity you can or you can give, or you can say any registered practitioner can prescribe the quantity of drug to a patient. Okay, so in this posology we will only discuss the quantity or dose of drugs administered in a different method to a patient to get the desired pharmacological action. Okay, so next point in the reveals that the dose of a drug cannot be fixed rigidly because, okay, so a dose of drug cannot be fixed rigidly means you cannot fix. Okay, various factors are responsible such as age, sex, severity of diseases. Okay, so age, sex, and severity of diseases, it is the main factor. Okay, so by seeing the factor that how much the patient is, and he is male, either male or female, or if it suffer from any diseases, so you should be considered. Okay, or you can say it should be considered by a practitioner. Okay, when he prescribed the drugs. Okay, the official doses in pharmacopoeia represent the average range of quantity. Okay, so official doses of pharmacopoeia represent average range of quantity, means in pharmacopoeia all the drug formulations and some actually rules is prescribed, and in each pharmaceutical industry try to follow that rules which is mentions the pharmacopoeia. Okay, and in this quantity is also added. Okay, in which quantity you can provide the dose. Okay, okay, so suitable for adults which is administered only within 24 hours. So it is suitable for adults which is administered orally, means mode of administration is orally within 24 hours. Okay, when other routes, sorry for some, when other routes of administration are followed, the relevant and appropriate dose is given. Okay, so there are lots of dosage forms are available, and in each method a appropriate dose is given to the patient. Okay, so you should be considered. So next slide, if you see this one, factors influences doses. Okay, so what is the main fact? What are the main factors which influencing the dose? Okay, so age, sex, body weight, route of administration, type of administration, environmental factors, emotional factors, presence of diseases, accumulation, additive effects, synergism, antagonism, syncracy, tolerance, and tachyphylaxis, metabolic disturbance. So these are factors influencing the dose. Okay, so next, if you see the age. Okay, so one by one we'll discuss how age means, you can say, factors which means I will discuss the factors influencing the dose. Okay, so first one is the age. So the pharmacokinetics, if any drug is given to you, to a patient, first of all, it moves inside your body. Okay, so this is the pharmaco means it is related to drugs. Kinetics means movement. Okay, of many drugs changes with age. Okay, so pharmacokinetics of many drugs changes with age. Okay, so in children or in adults or in old patients, the art pharmacokinetics is different. Okay, newborn infants is pediatrics. Okay, so in pediatrics, you can learn you can learn all about the newborn infants. Okay, जो नए बच्चे you can say newborn infants होते हैं are abnormally sensitive to certain drugs. Okay, so newborn baby infants are very, or you can say, very sensitive to many drugs, because immature state of their hepatic and renal function, their liver and their kidney is not fully developed. Okay, so it is immature. Okay, by which drugs are inactivated and eliminated from the body. So that's why what happened here, hepatic, it is related to the liver, and most of the drug it did uh, detoxify. Okay, or you can say degraded it. Okay, because many enzymes are present in this, which is responsible to break any diseases, to break any medicines or drug. Okay, so it since in this it is immature, hepatic and renal functions are immature in the newborn infant, so that's why drugs are inactivated, means they will not activated. Okay, so that's why they eliminated from the body. Okay, so there will be no pharmacological response because they are not, because they did not activate it. Okay, so failure to detoxify and eliminate drugs result in their accumulation in tissue to a toxic level. So failure to detoxify, so hepatic region is related to the detoxification, so that's why they will not or you can say they fail to detoxify and eliminate drugs result in their accumulation in the tissue, so that's why they eliminated in the tissue and causing the toxic effects. Okay, uh, whereas elderly patients are more sensitive to some drugs effect hypnotics, which may produce confusion state in them. So elderly patient means in elder patients are more sensitive to some drugs. Okay, so more sensitive to some drug effects such as hypnotics. Okay, so elderly persons are very sensitive to hypnotics, which may produce confusion state in them. Okay, so they produce confusion state, or you can say delusion. Okay, the second one is second one is the sex. So women do not always respond to action of drug in the same manner as it done in men. Okay, so men and women, okay, they will act different manner, you can say. Okay, special care should be taken when drugs are administered during menstruation and you can say pregnancy and lactation period. Okay, so in this time, menstruations and pregnancy and lactation, it is actually selective and occur in the women. So in these situations, special care is needed on that. Okay, so the strong purgative such as aloe should be avoided during menstruation. Okay, so when in menstruation period, you should avoid the purgatives. Okay, or you can say, for example, aloes. Okay, similarly, the drugs which may stimulate the uterine smooth muscles, example drastic purgative antimalarial drugs, ergot alcoholate, are contraindicated during pregnancy. Okay, so similarly, the drugs which may stimulate the uterine a smooth muscle, such as drastic purgative antimalarial drugs, ergot alcoholate, are indicated during pregnancy. Okay, so they stimulated the uterine smooth muscles. Okay, so in this situation, doctor will not prescribe that. Okay, alcohol, barbiturates, narcotic drugs act on the fetus during placenta. Okay, so through placenta, because placenta is connected to the fetus, so that's why these type of alcohol, barbiturate, narcotic drugs act on the fetus through placenta. Okay, so a special care is needed during pregnancy. Okay, you can say during lactation, morphine, tetracycline avoided because it affects on the babies. Okay, so these type of drugs will affect the baby. Okay, so doctor will not prescribe any such type of drugs. Okay, during this period. And the next one is body weight. Okay, so average dose is mentions either in terms of mg per kilogram body weight. Okay, so the average dose is mentions either in terms of mg per kilogram. Okay, so per body weight means 1 mg for 1 kilo. You can say actually this is definite that if any newborn infant is 5 kg, then how much means gram how much sorry it is actually the average dosage mentions are there in terms of mg per kilogram. Okay, so it is the unit actually. Okay, so if you are 10 kg, then a special quantity of mg drug is provided. Okay, so it is the ratio of mg per kilogram body weight. Okay, another technique used as a total singer for an adults weighing between 50 to 100 kilogram. Okay, so another technique used to total single for an adult weighing between 50 to 100 kilogram. Okay, so it is another technique. However, the dose expressed in this person may not apply in case of obese patient, children's and malnourished person. It should be calculated according to body weight. Actually, what happen in malnourished person, weight become lost. Okay, so according to their age, the drug and their condition, the drug should be prescribed. The next one is route of administration. So there are lots of dose of administration of drug is you are used such as IV means intravenous dose of drugs are usually smaller than the oral dose. Okay, so IV doses of drug are usually smaller if you compare from oral dose. Okay, because intravenous route this might enhance the chances of drug toxicity. Okay, so it in intra IVs suffer from some drawbacks, you can say, enhances the chance of drug toxicity. Okay, as compared to oral. The effectiveness of drug formulation is generally controlled by the route of administration. Okay, so if you want to effect immediately, then you can infuse intravenously. Okay, otherwise you can use orally. So it is the how much means what amount of effectivity the patient is needed. Okay, so that's why it is depending on the situation of patient. Okay, the next one is type of administration. The presence of food in the stomach delay the absorption of drug, rapidly absorbed from the empty stomach. Okay, so if you are going to take any drug, then your stomach will should be empty. Okay, if doctor prescribed to you. Okay, so it is the reason means absorption of empty stomach is much more as compared to fully stomach, you can say, but it does not mean that much effective when taken during after meal. Okay, so it is not related to any means if the doctor prescribed to you, then you can take in food free stomach or food filled stomach. Okay, so depending on their prescription. Iron, arsenic, cod liver oil should be given after meal, antacid drug taken before meal. Okay, so such type of difference means some type of iron, arsenic, cod liver oil given after meal. Okay, so if your stomach is filled, then you can use the iron, arsenic, cod liver oil. Otherwise, you if free situation, you can use the antacid. So depending on the types of drug you are going to take. Okay, so environmental factors is the personality and behavior of physicians may influence the effect of drug, especially the drug which is intended to use in a psychomatic disorder. So personality and behavior of a physician may influence the effect of a drug. Okay, especially the drug which is intended for use in a psych spasmodic disorder. Okay, so these are the environmental factor. Actually, the females are more emotional than male, require less doses of certain drugs. Okay, so emotionally the doses should be given differently. Okay, you can say females are more emotional as compared to male. Okay, so you can consider inner doses form called placebos. Okay, so inner doses form what it is called placebos, which resemble the actual medicament in the physical properties are known to produce the therapeutic benefit in diseases like angina pectoris and bronchial asthma. Okay, so inner doses form called means they will not they will not cause any pharmacological response. So it is the inner doses, and it is called placebos. It is very important point, which resemble the actual medicament in the physical properties. Okay, so it represents the actual medicament in the physical properties, are known to produce therapeutic benefit in disease like angina pectoris and bronchial asthma. So it is the two drugs is given here. Presence of diseases, so drugs like uh, barbiturates and chlorpromazine may produce unusually prolonged effect in patient having liver cirrhosis. Okay, so in case of liver cirrhosis, barbiturates and chlorpromazine are more effective. Okay, or you can say it shows the prolonged effect, such as streptomycin produce toxic effects on these patients. Their kidney function is not working properly because streptomycin extracts to kidney. So streptomycin produce toxic effect on these patient, their kidney functions are not working. So you cannot use the streptomycin, or doctor will not prescribe the streptomycin if you suffer from kidney diseases. So it is the presence of diseases. Okay. Accumulation, some drugs produce the toxic air which is repeatedly administered for a long time, digitally cementing heavy metals because these drugs excreted slowly. So depending on the excretion, if excretion is slow, such as digitally cementing, then they will collect in your body and produce the toxic effects. So you should consider these points. Okay, this occur due to accumulative effect on the drug. Okay. Additive effects, when two or more drugs administered together is equivalent to some of their individual pharmacological action, the phenomenon is called additive effects. So additive effects, if you are going to do use suppose that Ibumax or paracetamol, then and if you use along with two or three drugs, then it is called additive effects, or they will cause the other pharmacological response. So it is the additive effects. Okay. Ephedrine aminophil is the treatment of bronchial asthma. Okay, so same pharmacological responsive drugs will enhance the activity. So this causes the additive effects, you can say. Synergies, when desired therapeutic result needed is difficult to achieve with single drug. At the time, two or more drugs are used in combination for increasing the action. This phenomenon is called synergy. So for enhancing the pharmacological response, you can use two or more drugs having similar pharmacological activity. Okay, such as, for example, procaine, adrenaline combination increases the duration of action of procaine. Okay. So antagonism, what is the antagonism? When the action of one drug is opposed by other drug. Okay, so if one drug neglect the efficacy of other drug on the same physiological system, then it is called drug antagonism. Okay, use use of antagonist response to drugs is valuable in treatment of poisoning. So in poisoning cases, you should antagonize the effect of the drug which able to cause the poisonous effect inside the patient body. Okay, such as milk of magnesia is given in acid poisoning, whereas alkaline effect of milk of magnesia neutralize the effect of acid poisoning. Okay, so you can see this one. Okay, when adrenaline and steroid are given together, they neutralize the effect of each other due to antagonism, because adrenaline is vasoconstrictor and steroid is vasodilator. Okay, so they neutralize the effect of one another. Okay, so you can see the effect in the solution medium. Okay, in which receptor is present. Okay. So it is the first lecture. Okay, I have mentioned the 13 slide I have explaining, and if you like this video, please first of all, if you have any queries regarding these topics, you can mention your queries. I will explain further. Okay, so and if you are new on this channel, then please like and subscribe, and please also mention that you should like this lecture or not. Okay, so thanks for this. Okay.